It's my turn. Okay. In the name of Allah, most gracious and most merciful, the cherisher and the sustainer of the whole universe, I greet all of you with the greeting of Islam. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm not sure where my screen is now.
We can see you, Doctor.
Okay. Am I in the screen now?
Yes, I can see.
Oh, good, good. I should keep going. Again, assalamu alaikum wa rahmatullahi wa barakatuh. It's really an honor to be with all of you today, and thank you so much for that wonderful initiative of dealing with the mental health issues and having, ICNA, especially Dr. Ishraq, to emphasize those issues to our community, which it's really unfortunate, never happened before. But alhamdulillah, and we're catching up. We're trying to share with our people, our audience, some aspects of those mental health issues, including, of course, autism, as we had last time, and this time ADHD. Wonderful to have Sister Sarah and Sister Sana with us to speak today. Again and again, I really appreciate all of those efforts and energy to have this topic discussed. About myself, as I was introduced earlier, I'm Hamdy El-Sawaf. I have my MA and PhD in psychotherapy at the University of Minnesota. I worked at the university for a while in research, teaching, and so on and so forth. I retired. Now I'm practicing as a psychotherapist, also being the Imam of Masjid Al-Iman, the Islamic Community Center of Minnesota, helping the community as much as I can in this area, and also in Islam as well. As for my topic, let me see in here. How I can I want to go to my PowerPoint presentation in order to share with you, but I'm here. I am wondering why it doesn't display.
Did it allow you to select share screen?
Go to where?
Share screen should be up on the top, I believe. It depends on your computer type.
Okay.
The screen should share your desktop screen, and then you should be able to open your PowerPoint. Inshallah.
Oh. Oh, here you go. The PowerPoint presentation would be seen by all of you now? Yes? No?
We don't see it yet. Did you select share screen? Were you able to find the button that says share screen?
Let me see.
If it's easier, Dr. Hamdy, you can email it to me and I can share a screen from my end.
have some.
So now your screen is sharing. There you go.
Okay, if I could be here, I would go ahead and speak. Okay, the ADHD. I would go somehow differently than what Sister Sana presented. Looking at some specific things, first, when I included in my presentation about the title of politics, how the politics was and is still really related to that topic. Years and years back, Kennedy family had some of their kids, diagnosed with some mental health issues, and what it is exactly, would it be autism, ADHD, learning disabilities, and so on and so forth. But they had that experience, they had to deal with it. Not only the family of Kennedy, but also George Well, that commentator and that writer, had the same problem within the family. He had to deal with it. Even here in Minnesota, the Humphrey family, they had some kids with some mental health issues. So the three of them nationwide were working so hard in order to find out what is going on, having some educational setting, studying, research, and so on and so forth. At that time, I thought about studying that area as well, and I said, oh, this would be really, really, really interesting, to look at, that issue. I chose my topic for my PhD degree at the University of Minnesota, mainly to be talking about the psychological aspect of peer interaction between children with and without developmental disabilities. I decided to go this way and have that comparison in order to have a deep understanding. Here are the kids with normal life, and here are the kids with developmental disabilities. See, what is going on in here and there in order to find out. And then I developed this to look specifically at psychological, social, and communicative interaction between children with and without developmental disability. And some people might be wondering why you look at the psychological, social, and communicative interactions. If we do not emphasize about these three major issues in our life in general, and with the children with or without developmental disabilities, we won't be able to understand what is going on in their life. So I emphasize this, and I have the comparison between children with and without to find out the differences, and then you look at what is going on. And of course I interviewed the kids, just videotaping some specific behavior, as well as the parents, in order to have some feedback from them to tell us about their children, because you cannot really have whatever you're looking for only from the children. You have to relate to the parents as well in order to find out from them what is going on in their life. The aspects of emphasis, I would say we have to look at it carefully, and we have to emphasize as much as we can the communication. It's extremely important to find out, in one side between those children or adults with ADHD and their parents and their siblings and their classmates and in general and their friends and so on and so forth. Look at the verbal aspect of their life, how it has been developed normally, or something here would tell us that, in their communication, there is something we have to find out, what is going on in that verbal issue. Have they developed that verbal communication a normal way, like some other kids are doing, or they are behind on some specific things? They go so fast, so slow. Sometimes they don't respond at all, just being silent. That's one. The nonverbal communication, instead of talking and communicating, they might, go with sign language or the body language. We have to understand, as parents and people around, to those kids with ADHD, the communication aspect of their life, whether verbal, non-verbal, or sign language, in order to help us understand the life as much as we can. Also the relationship. What I meant by the relationship of those kids with ADHD or adults with ADHD, first with their parents, second with their siblings, third with their classmates, fourth with friends, with nature, with himself or herself, and finally with Allah subhanahu wa ta'ala. You might be wondering why I choose, those aspects of relationship. With parents first, ADHD, and with parents, what kind of relationship they do have. Some parents would be very, very disappointed, would be frustrated, would be kind of even questioning, why me? Why my children? And this actually would help positively or negatively in their relationship with their children. Some parents, when they look at this issue, they wish they wouldn't have that child, or he would be gone, or why, I have such a kid who is not normal like the other kids around. If it is a negative relationship between parents and the children from the parental point of view, this would be really negatively impacting the life of that child, the development of that child, the way dealing with life, and so on and so forth. If there is a full support, and I mean it, a full support from parents in their relationship with those kids with ADHD, do not expect a lot to be developed in their life. If they do not know how they develop that relationship, read about it, understand about it, ask about it, find out from the experts, ask social workers, psychologists, psychotherapists, psychiatric, whoever, some parents who had the same issue in their life, and so on and so forth. Extremely important having parents with a positive aspect of their life with their children. It would help those children to develop a wonderful life. With their siblings, sometimes the siblings would be wondering why, my brother or my sister, older or younger, would have such a thing. We have to explain to them. They have to understand. They have to read about it. They get to find out, somehow, because kids, either older or younger, if they do not develop that relationship with their sibling in a positive way again and again, they'll be rejected. Psychologically, emotionally, mentally, you name it, they don't feel they do not belong. And this issue here, we have to emphasize, we have to look at. With the classmates, do their classmates at school, they go to understand what is going on with ADHD? I believe that if they go to school where kids, all the kids together, with or without ADHD, teachers should explain to them, if they do have some kids with ADHD, They don't go to special school, but they go to regular school. Kids around them, classmates around them, got to be aware of that issue. What ADHD, how they deal with them, how they communicate with them, how they help them. You know, it's extremely important, and this would add a wonderful aspect to their life, and it would be very helpful. With friends around, no matter what, school or outside school, the same thing. They got to be aware also of that issue of ADHD, have specific techniques to deal with the kids with ADHD, how to relate to them, how to support them, how to help them in a lot of things. With nature, you know, in general, we do not consider the factor of nature in our life, how to relate to it. Tell me how many times a week you go outside to have a walk and just look at the nature around you. Look at the trees, even in winter time, when it is snow, heavy snow, it is cold. When it is 90 degrees or 100 degrees, you know, how you deal with this issue, how you relate to it, how you accept it, how you reject it, how you deal with it. ADHD kids, they got to learn how to relate to nature as part of their life. It would really help them to understand what is going on around them. So it is not only people, whether it is parents or friends or classmates, nature, you know, got to relate. Go for a walk, go find out what is going on, go to a park, spend some time there away from home. Home is a home. With 2-bedroom, 3-bedroom is still very tiny, very not enough for them to move around and so on and so forth. With himself or herself, does he or she understand what ADHD is? Or he just or she is just diagnosed with ADHD without knowing what ADHD? Explain to them. Nothing wrong at all. To explain to them, here's what you have, here's what you're suffering from, here's what's going on in your life, here's what you should be doing, in order for them, because some of them would really hate their life, hate themselves. Till the point, some of them, and I'll come to that, side effects of the medication, they would take some specific medication, and that medication with the side effect, as well as the attitude of that child, they have the tendency to commit suicide. How we explain to them what is going on in their life, to deal with it normally, not to just, you know, it's abnormal. ADHD, you're different. ADHD, it is something, you know, some of the kids would be ashamed of. Why don't you let them have a wonderful relationship with themselves by understanding what is going on in their life and so on and so forth. The last one, with Allah. And when I develop those aspects of relationship, I have seen kids, I've seen families, I've seen many people who come and consult with me or seek some help and so on and so forth. What I found out, which is really, really, really sad, really unfortunate, really kind of I cannot explain it more, but some parents would be really complaining, why me? Why us? You know, what did I do in my life? Is it a punishment from Allah to me to have kids with ADHD or developmental disabilities? Would I accept this as from Allah to me, not as a negative impact in my life, but take it literally, I mean it, as a gift from Allah to me, as a test from Allah to me, as a ibtila, an ikhtibar, وَلَنَبْلُوَنَّكُمْ فِي أَمْوَالِكُمْ وَأَنفُسِكُمْ. Allah subhanahu wa ta'ala will test us once in a while. So dealing with Allah subhanahu wa ta'ala in that issue, you know, I would be, you know, accepting whatever is happening. Kids would accept it, it is from Allah no matter what. And parents would accept it, it is from Allah subhanahu wa ta'ala. And I have to deal with it. It's really, really unfortunate when I'm saying that specific issue, relationship with Allah subhanahu wa ta'ala. Some parents, when they do have any kind of mental illness or any kind of developmental disabilities, you name it, autism, ADHD, and so on and so forth, right away they would go. I have seen it, I have experienced it. They come to me, they call me and say, oh, doctor, yes, or go somewhere else. They are touched by jinn, touched by jinn. Something very, very weird to some parents telling you that, no, I don't believe in that diagnosis of ADHD. No, it is the jinn who touched my son or my daughter and caused all of what they have been suffering from. And you would ask them, if you believe in this, what do you need from me? If you're not seeking some professional help, some medication, some people with expertise, you're coming to me, you're telling me you have a diagnosis for your child saying that is touched by jinn. Oh yeah, I'm telling you, doctor, I need, and listen to that one, I'm sure you heard it many times, I need ruqya from you. You're an imam, you're a hafiz of the Quran, you know the whole Islam, and so on and so forth. Make a ruqya, read Quran for him or her. And I'm willing to come to you as many times as you wish, or as many times as you can arrange for me to bring my child to you, to read Quran from you on him or on her, because he's touched by jinn. And with that ruqya, you know, that jinn will go away. It's really unfortunate. Many parents with their kids with developmental disabilities, especially ADHD or autism, when they go to specific people, knowing that that person, you know, the hafiz of the Quran, he can do ruqya, and so on and so forth, spend a lot of money, paying money to those people, and sometimes they can't even afford it, but they have to pay money for that sheikh or that imam in order to have the ruqya for their kids, hoping that their kids would be cured. It's really unfortunate. After a week, after a month, sometimes a year, sometimes a couple of years, sometimes 3 years, no whatsoever treatment by the ruqya with respect to the Quran. No doubt about it. And ruqya, by the way, sometimes it is needed and it got to be done. But for some specific people, that the ruqya would help somehow, because it's mentally, psychologically, emotionally, when we hear the Quran, and so on and so forth. But when it comes to ADHD, you treat it with ruqya, you treat it with Quran, you have to go to professional people in order to help. I am afraid if we're not including as social worker, as psychologists, as psychotherapists, as psychiatrists, when you are confronted with that issue of the ruqya and jinn, how you deal with it. Seek professional help first. And then we can find out if he does or she does need a ruqya or reading the Quran and so on and so forth. And by the time, you know, we're spending with our children with that ruqya and jinn and so on and so forth, things are getting worse and worse and worse, because we're not seeking the right way of dealing with those issues in the lab. I would really urge us as professionals and parents as well, when you have children with those type of developmental disabilities, autism, ADHD, you name it, seek the professional help with those who are specialized, who can help us. You want to read Quran for them, okay, once in a while. Yeah, I'm not ignoring, but this is not the way in order to help them. That's why I included in here in terms of relationship. We got to be careful. Otherwise, if we stick to that thing, being away from Allah the way it should, we're making the case of our child worse and worse and worse. We're not helping him or her. We're not seeking any cure for them. I would go to the medication issue in here, and the side effects. Most of the time, with many patients, with any mental, psychological, emotional issues, and we take our people, or we go ourselves to a psychiatric. He's the one or she's the one who prescribe medications for cases, you name it, whatever that case is. I'm not against having anyone with any mental, psychological, emotional issues to seek some help from a psychiatrist. I'm not against that. But we have to be extra careful with the medications that has been prescribed to those patients. Why I'm saying that? Find out and challenge me. Any medication, not necessarily prescribed to those people with mental, psychological, and emotional illness in their life, any medication, tell me any one of them does not have side effect. All of them, even aspirin, ibuprofen, Tylenol, you name it. They do have side effects. And sometimes those side effects would be negatively impacting that patient worse than the illness or the sickness or the mental or psychological and emotional abnormality those would have. If my child went to a psychiatrist and the psychiatrist would say, okay, ADHD, we have to give some medication, Kilopre, amphetamine, methylphenidate, and so on and so forth. Ask him right away or her, doctor, what are the side effects of those medications in order to be aware of? We're not aware of what might happen. If something happened, what should we do? In my career, when I see many clients coming to me and seeking some help, one of the major questions I would ask them, have you been taking any medications for that, whatever you do have? Yeah. Bring me a medical report of what you're having. The psychiatrist prescribe to you what kind of medication you're taking, and then I would look immediately at the side effects. I can share with you from my very humble experience in our community. Some of our people were diagnosed with depression or severe depression or some other mental, psychological, emotional issues in their life, and they have been taking those medications for years. You know what happened to some of them? And instead of curing that mental health issues in their life, they ended up, and listen, committing suicide. The medication they were taking as antidepressant medication, it developed in them that way in order not to live anymore. I cannot live anymore, end up my life and commit suicide. How do I know that? Those kids after, or those adults, after they passed away, subhanallah, and some of the parents would come and discuss the matter with me, or I myself, I would ask, how that young man or woman died. Oh, he or she committed suicide. Was he diagnosed with any mental health issue? Yes. Was he taking any medication? Yes. Did you find out about the side effect? No. Did you ask about it? No. Did you? No. and our sons and our daughters, because of the side effects of the medication they were taking, they were gone. They committed suicide. They killed themselves. Subhanallah. We have to be careful. I'm not making anyone scared or anything, but we got to be extra. Ask. You won't lose anything. Wallahi, subhanallah. Yani I remember a few years back, 3 sisters, along with their brother, and they found out that their brother, very, very depressed, and skipped school, does not finish high school, was taking medication. When I asked, I said, yes, was taking medication. What kind of medication? They told me it's antidepressant, and no improvement. He doesn't sleep well anymore, doesn't eat well anymore, doesn't say, okay, bring me his medical report. I look at the medication, which I said, Ya Allah, none of those medication he needed. First, it didn't help. Second, no improvement. Third, his case is getting worse and worse and worse. Subhanallah. I interviewed them. I interviewed the mom. I interviewed that kid. I said, where is your dad? He said, he's not here. Where is he? He said, overseas, somewhere. I said, how come? He said, yeah, mom and I came here to live here in America. Dad couldn't make it, so we're living here and dad is away from us. I said, okay, can he come? I said, no. What he's doing there is working. What else? Say, he get married to another woman. I said, okay. How do you feel? I said, I miss my dad. I would love to see him. I cannot live without my dad. I keep on and on and on. And I found out that the depression, the severe depression, he's suffering from, he's missing his dad. I had to communicate with his dad. Over and over and over, and have the dad communicate with his son. It took us 9 months to develop a wonderful communication between that kid and his dad, and convince him to have more and more and more of communication, believe it or not, without medication, without anything else. The kid was improved. Wonderful life. No need for medication. No need to be diagnosed with, yeah, he was depressed, no doubt about it. But mainly, no need for medication. Consequently, the side effect. Here, when it comes to our ADHD, when we find out about those medication prescribed to them, one, again, the Calipri, I would share with you some side effects in here in order to be extra careful. When it comes to Calipri is once a day ADHD medication for children age 6 to 17. In clinical trials, Calipri has been proven to help reduce ADHD symptoms with manageable side effects. That's one thing. But here, what we should be careful when you look at the side effects, because the medication they would be having. Don't be surprised. Don't be shocked. Some suicidal thoughts and behaviors. Closely monitor all Calipri-treated patients for clinical worsening and emergence of suicidal thoughts and behavior, especially during the initial few months of drug therapy. And at times of dosage exchange, heart rate, blood pressure increase. Calipri can cause an increase in systolic blood pressure and heart rate. assess those measures prior to starting therapy, following increase in dosage, and periodically during therapy. How about amphetamine? Amphetamine is a central nervous system stimulant that is used to the treatment of attention deficit hyperactivity disorder. It was discovered long time ago in 1887. But when you look at the side effects in here, you would find the following: dry mouth, nausea, extreme mood changes, decreased appetite, trouble sleeping, dizziness, weight loss, restlessness, increased heart rate, stomach pain. Common side effects, subhanallah, were like some other things in their life. The third one in here, which is the methylphenidate, it belongs to a group of medicines called stimulants. They work by increasing activity in the brain, particularly in areas that help control attention and behavior. It is used to treat children with attention deficit hyperactivity disorder. What would be the side effects in here? As I mentioned, we get to be extra careful looking at those side effects. Here, one thing I would add too, as a matter of fact, the adverse reactions. Most common adverse reaction here in patients 6 to 17 years were decreased appetite, fatigue, nausea, vomiting, insomnia, and irritability. In adults, insomnia, headache, fatigue, nausea, decreased appetite, dry mouth, and constipation. When it comes here to this is what that adverse reaction I was referring to. When it comes to the pregnancy, there is a pregnancy exposure registry that monitors pregnancy outcome in women exposed to the first medication I was talking about, the Kelipri, during pregnancy. Healthcare providers are encouraged to register patients by calling the National Pregnancy Registry for a psychiatric medication for that particular people. Here I would stop, but again and again, why I've been emphasizing those medical side effects, because most of the time we do not pay attention to them, and most of the time, once you have a diagnosis of ADHD, have some treatment this way and so on and so forth. But again and again, emphasize the relationship between those kids with ADHD or adults and the side effects of the medication, and here would help us. At that point, I would stop, and thank you so much for listening. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Dr. Hamdy. Sarah, you're welcome. Assalamu alaikum, everyone. My name is Sarah Kiani. Thank you, Dr. Hamdy, for that lovely presentation. First off, I want to excuse everyone for my voice because I've been very sick with a respiratory virus, so I have a weak voice and I may cough during the presentation, but I will do my best to share my information with you. Is everyone hearing me okay? Yeah? Yes. Okay, great. I have a nature theme around my head better than my blank wall. And as Dr. Hamdy mentioned, I love nature and actually incorporate it into a lot of my therapy work. So I'll tell you a little bit about myself and my work, and then I'll talk about my personal experience with ADHD and my clinical work with children and adults with ADHD. So let's see, for some reason, I am not seeing. There we go. Okay. All right. So I am a therapist and a licensed professional clinical counselor. I am the founder and director of an agency called Hope Tree Counseling Services. We have locations in Iowa and Minnesota, and we serve children, adults, and families with outpatient clinical mental health counseling. So we do 45-minute and 1-hour sessions to help folks with a whole big variety of issues. And I do individual sessions and then sometimes work with families. I do a lot of parent-child work.